Today's talk is going to be on a couple different interesting cases that I will present to you, and then there will be confusing cases based on the literature, and hopefully I can help you interpret these complex studies that are out there. So the theme actually is estrogen in men and what exactly should we be doing about it based on the medical literature. It is probably a little bit different than what you have read and what you have come across. So I'll start with a couple different cases, and the theme would be, where would you like your estradiol levels to be? Well, let's look at a first case that has to do with women, and the results of this study suggest that premenopausal women that have elevated testosterone levels have a significant increased risk of breast cancer. That's true. In every study to date, women that have higher testosterone levels have a significant increased risk of breast cancer. Now, why in the world would you want to prescribe testosterone to a woman when all these studies show that there's an increased risk of breast cancer with testosterone? It makes no sense. Why would you do that? Don't you believe the study? Do I prescribe testosterone to women? Well, of course I do. Yeah, but this study says. Okay, let's see why the study says what it says. It says that elevated testosterone levels in women are associated with an increased risk of breast cancer. Well, it's that testosterone that's causing the breast cancer. No, it's not. And it's an innocent bystander. And of those of you that understand what Pcos is, in polycystic ovary women, they have a significant decreased incidence of production of sex hormone binding globulin, which frees up the testosterone to be elevated. And as a result of that, we're saying, though, those high testosterone levels are causing the breast cancer. It's not that. Women with PCOS don't make progesterone. Women with PCOS have increased insulin resistance and increase in visceral fat, which puts them at great risk for breast cancer. There's a 6.4-fold increased risk of breast cancer and uterine cancer in women with PCOS. Why? Because they lack progesterone. It's the progesterone that's lacking that's the important key to understanding that that's probably attributing to the increased risk of cancer in addition to the increase in visceral fat and the insulin resistance. It's not the testosterone, but it's an association. Association does not prove causation. So then you have to look at, how do you then prove causation? You have to do an interventional study. When you intervene and give testosterone to women, in every study today, and in postmenopausal women, it protects against breast cancer. My congratulations to Dr. Rebecca Glasser, who finally got her article published in Maturitas recently, showing a long-term study that testosterone administration to postmenopausal women decreased and protected against breast cancer. But when you look at this article, you can see that this is an association. It's not causative. Association does not prove causation, and you have to read into to try to figure this out. That's why observational studies are not that powerful, because of that. Another study looking at these results show that body mass index and increase in sex hormone levels are associated with increased risk of breast cancer in women. The results are compatible with the hypothesis that the increase in breast cancer risk with increasing BMI, that's obviously due to the insulin resistance, is largely the result of the increase in estrogens. And every study to date, when you measure baseline estrogens in postmenopausal women, the higher the baseline estrogen level, the greater the association with breast cancer risk. Why would you possibly want to give a woman estrogen when it's associated with an increase in breast cancer in every study to date? Do I give estrogen to women? Of course I do. Yeah, but it says here that there's an association. The higher the levels, the greater the risk of breast cancer. That's absolutely true. But that's an association. Associations do not prove causation. How do you prove causation? You have to intervene and do an interventional study. In every interventional study to date, the most powerful one being the Women's Health Initiative, estrogen did not cause an increased risk of breast cancer. It decreased the risk of breast cancer. In the recent Danish trial, in the Chronos study, and the EPAT trial, and the CORA studies, those studies using estradiol all showed and proved a decreased incidence less than placebo for breast cancer incidence. Those are interventional trials, and that's what you have to do, is look at the interventional trial. You can't look at an association. See the difference? Sex hormone binding globulin is associated with a decreased risk of breast cancer. We actually want the sex hormone binding globulin level up. In every study to date, that's a 2-hour lecture, an increase in sex hormone binding globulin protects against heart disease and protects against cancer. Does transdermal estrogen raise sex hormone binding globulin? No, it does not. What raises sex hormone binding globulin? It's oral estrogen. That's just a little tidbit. But what about the rest of the article? Levels of endogenous sex hormones are strongly associated with breast cancer risk. That's both testosterone and estrogen. In baseline levels in women, the higher those levels of hormones, the greater the risk of cancer. Why would you possibly want to give those women then hormones? Do I give those women hormones? Absolutely I do. Why? This is an association that does not prove causation. In baseline women that have increase in visceral fat or obese will have a significant increased production of their hormones from the visceral fat. The hormones are an innocent bystander. It's not causative. It's the insulin resistance and the increase in inflammatory cytokines and the diabetes that's causing the increased incidence of heart attacks and cancer. Well, let's intervene. When we intervene and give women estrogen, what happens? It protects them against heart disease. It protects against that plaque buildup. I showed you in the studies yesterday on estrogen in the brain. Every study to date shows a protective benefit against Alzheimer's disease as well as plaque buildup. However, it can cause plaque rupture in older women. Well, that's an exception, but for the most part, in newly menopausal women, estrogen is very protective against heart disease. Yeah, but it says right here, it's very protective against breast cancer. Yeah, but it says right here, that's an association. An association does not prove causation. Get my drift? Okay, let's move on. Higher serum concentrations of estrogens are associated with increased risk of breast cancer. Again, that's an association. In order to prove a causation, you have to intervene and give estrogen. In every study to date, when we give estrogen to women, there is no increased risk of cancer. But yet, baseline levels are associated with an increased risk. Do not make an association and extrapolate it into causation. You have to look at the interventional trials to then see.